Thank you for inviting me. I'm here to present the SMIL cohort and then some findings in combining consumer purchase data with data from the Danish registries. And I'm a master in public health. So the Starbucks app provides the foundation for inclusion in our cohort, and it's a smartphone-based application that collects receipts from all supermarkets that are part of a corporation called Danish Supermarket. And this SMIL study, SMIL study in English, asks all the Starbucks users to be a part of the study, and they do so by informing their CPR number to a protected site, which is then included in Statistics Denmark and encrypted, which allows us to connect all of these receipts to the Danish registries. And maybe some of you know that the Danish registries are very nice because there's a lot of information, including but not limited to age, sex, prescriptions, contacts to the hospital, income, education, family structure, biochemistry measurements, and much more. This is a plot showing from 2018 to 2022, and the y-axis goes up to 13,000, and this shows the continuous inclusion of the cohort over time. And for December 2021, we had included 11,000 shoppers in the cohort, of which 63% were male. The median age was 47. The education, income, and degree of urbanization pretty much aligns with the average distribution in Denmark. We haven't done a study on this, but we have got sort of a broad inclusion. The characteristics were that 5% has diabetes, 12% has hypertension, and 13% has cardiovascular. Some of the key members. So currently, our database includes 180 million unique purchases, and that includes both edible and non-edible goods. And this translates to approximately 700,000 unique product names. And we have so many because the data that we get, we only have information on the name that is on the receipt, and that name is decided by the grocer when including the product in their product range in the supermarket. So they're very unique, and sometimes there's 5 different names for the same good, also because it also involves typos and stuff like that. Yeah, thanks. And we translate these to approximately 1,200 food items and 29 wild food groups that we've come up with in cooperation with statistics. And we do so by using an R-based algorithm using regular expressions, regex R, and using data that Thor also presented from, which is the Danish Public Food Composition Database. And this is something that we continue to work on, also in collaboration with like Thor and Caroline here at the Institute. Yes, and some key numbers is that in 2021, the median amount spent was around 800 euros, and the median number of shopping trips was 45. So it's considerably lower than what you would expect if we had the totality of one's purchased. So moving on to our first study on this data, we aim to compare the monetary percentage spent on specific goods between households with individually with diabetes and households without. So we included all purchases in 2019 and defined diabetes by at least one member in the household redeeming a proposal drug before baseline. And then we compared the monetary percentage used on specific good out of the total expenditure used on edible goods. And we then used a probability index model to adjust for confounders. And we included almost 10,000 households, of roughly 10% with diabetes. And for adjustment, we included information on family structure, degree of urbanization, highest educational attainment in the household, and equalized income. We found that households with diabetes were less likely to have children, or more likely to live in rural areas, and have lower education and income. And this is a plot of our main findings with the 28 groups and p-value and the point estimate to confidence interval of our probability index model. And I will zoom in second. And the ones on top is are the ones where there was statistically significant difference, where households with diabetes had a lower probability of purchasing more of these goods, and the ones in the bottom were the good groups where households with diabetes had a higher probability of purchasing more of these goods. And one of our main findings was actually not what the households with diabetes purchase more or less, but how little difference there was. So this was kind of an answer to a study made by Diabetes Study Center in Denmark, based on food frequency questionnaires, that found that households with or individuals with diabetes had a more healthy purchasing pattern than the general population. So, but what we found was that they purchased just as much sugar drinks, just as much wheat, and just as much chips and salty snacks. And I didn't include the number, but overall, all households spent roughly 11% of their expenditure on sugary like candy and chocolate.
So I could just explain what the 0.258 grams has to interpret that.
Yeah, that's the probability that the households with diabetes purchase more of that specific good.
That is slightly less likely than much.
Yeah.
Okay.
So the null is 50%.
Yeah.
Yeah. So zooming in, this would we employed a Bonferroni corrected p at a significant level, and so also diabetes produce less of grains, rice and pasta, alcoholic beverages, accessory compounds, eggs and vegetables, and converting more of ready meals, sugary drinks, and processed red meat. Yes, moving on to our second study that I wanted to share with you today. Here we aim to compare purchase patterns in households with at least one member with overweight in childhood compared to present households. And here we included only Starbucks households where at least one individual had their BMI measured maximum 10 years prior to purchase. Yeah. People, yeah. And we included 700 households, and of which 200 had overweight obesity and 500 had underweight or overweight. And this is a plot showing the unadjusted results. So this is the proportion expenditure regarding the 6 main food groups of interest that we investigated in this paper. And here we found that households with overweight spent more on confection, salty snacks, ready meals, and sugary drinks, relatively more, and conversely less of fruits and vegetables. And when we further adjusted this for degree of organization, income, education, family structure, we found the same tendencies, although only statistically significant for vegetables, sugary drinks, and last one is ready meals. So this is this was the Bonferroni column adjusted p-value. So we conclude that consumer purchase data can be used to investigate differences in households' food environment and may serve as a proxy and supplement self-reported measures. And specifically, our findings revealed that household diabetes purchased relatively more of several unhealthy food groups, less of several healthy food groups, but more generally just as unhealthy as households without diabetes. And furthermore, we found that households with an individual who had overweight or obesity in childhood purchased relatively more sugar against ready meals and less of vegetables. And now would be the time that I would have a slide with the strength and limitations of consumer purchase data, but I've actually removed that kind of last minute because you guys already know. So I would rather say a little bit about limitations and in the methods and future directions. So definitely, I think improvements and new directions can be made in categorization of goods, also with these new strides in language processing models. And I'm really looking forward to following this area. I think now we employed hypotheses surrounding specific food groups, but I think there's also something to be said about reducing this high-dimensional nature of the data and maybe looking more into a healthy purchase index, like one spearheaded by Kold Sørensen. There's also this possibility of instead of looking at food groups, then looking at micro and macronutrients, which we already have information data. I think also it would be very interesting to further address and use this longitudinal structure of the data, because we've been collecting data for 5 years, and these two papers have been summarizing over a long time period. So I think, but to my knowledge, these methods are very complex and difficult. So, and these methods would also help address questions pertaining to incident disease. And one project that I have in my drawer that I think is very interesting is looking into purchases and HbA1c levels over time. But the methods are difficult. Lastly, I think very nice to be with all of you guys today that knows the strengths and the limitations, but it's very important to convince others that these samples of household purchases are relevant, and with others are probably us. So thank you. And that's a QR code to the first paper that we have published, and